It's a great honor to talk on behalf of all their colleagues about the update on the ClarIDHy study, which is the phase 3 clinical trial, if you remember, of Ivosidenib versus placebo in patients with previously treated cholangiocarcinoma with IDH1 mutation. If you recall, the study was a randomized trial, 2-to-1 randomization, Ivosidenib versus placebo, with a crossover. Patients on the placebo, if they were to progress, were permitted to go to the Ivosidenib arm. The primary endpoint, understandably, in view of the crossover, was progression-free survival, which was positive, 2.7 months for the Ivosidenib versus 1.4 months for the placebo. But more importantly, the separation continued to be present, 32% PFS for the 6-month rate and 22% PFS for the 12-month rate for the Ivosidenib, and not available for the placebo because simply there were no patients there. This also translated in improvement in survival. Understand because of the crossover, the survival had to be recalculated based on a technical tool, which is statistical method that will allow to presume that patients are still on the placebo arm despite they crossed over. It's called the rank preserving structural failure time. Based on that RPSFT, or rank preserving structural failure time, the mean survival for the Ivosidenib was 10.3 months, and for the placebo was 5.1 months, with a critical improvement in outcome with a hazard ratio of 0.49 and a p-value of less than 0.0001. Understandably, we are presenting also a revision of the adverse events, which are limited, mainly nausea, diarrhea, and fatigue. And we have noticed also in grade 3 ascites, anemia, and increased bilirubin. But also adverse events were noted a certain equal rate in the placebo arm. And we also showed on the different quality of life, especially the URTC QLQC30 and the URTC QLQ-BIL21, a favored approach of improvement outcome with the Ivosidenib. As such, we concluded that Ivosidenib is a treatment that demonstrated a highly statistical improvement, progression-free survival, and a survival improvement in a numerical improvement noted when we pretend the patient did not cross over. And number 2 is the drug is safe. And of course, we look forward to see it hopefully approved. And of note, based on the presentation at ASCO, we are aware of a supplemental drug application that was filed with the FDA early this year.